Hey, welcome back to the PTCB Prep Guide. We're all about making those tricky pharmacy concepts super simple so you can remember them for the big day. Today, we're tackling integumentary system disorders. We're going to cover the must-know definitions, the top drugs, generic and brand, and give you some real-world context to lock it all in. So our whole mission here is to arm you with that high-yield info, the stuff that's almost guaranteed to pop up on your exam. Let's dive right in and get you ready to pass. All right, first things first, we're going to do a quick-fire round of essential vocab. Seriously, these terms are all over the PTCB, so knowing them by heart will give you a major leg up. Okay, first up, pruritus. That's just the fancy medical way of saying itching. And for the exam, you need to connect the dots. Itching is caused by histamine release, during an allergic reaction. And that's exactly why we reach for antihistamines like Benadryl or Claritin to treat it. Next, we've got erythema. All this means is redness of the skin. Just think about a sunburn, right? That red color is erythema. It's a visual cue that your body is sending extra blood to that spot to either fight something off or start the healing process. And then there's edema. This one's pretty straightforward. It's swelling. It happens when extra fluid gets trapped in your body's tissues. You might see it after an injury, or sometimes it's a side effect of a medication. Just remember, when you see edema, think swelling. Moving on to scaling, you've definitely seen this before. Think about dandruff or psoriasis. It's that flaking of the outer layer of skin. And what causes it? A buildup of a protein called keratin. When your body makes way too much keratin, you get that scaling effect. And last for this section, we have hives. Now listen up, this is a big one. You have to know both names, hives and its medical name, urticaria. They are those annoying, raised, itchy red bumps that show up when you're having an allergic reaction. The PTCB could throw either term at you, so be ready for both. All right, you made it through the vocab. Now let's get to the real meat and potatoes, the drug list for skin infections. Trust me, matching the right drug to the right bug is a huge part of the exam, so this section is absolutely critical. We're kicking things off with bacterial infections. The number one bad guy you'll see mentioned is Staphylococcus. So the name of the game is knowing exactly which antibiotics we use to shut it down. Okay, take a good hard look at this table. These brand and generic pairs are non-negotiable. You just have to know them. We've got azithromycin, that's Cithromax. Cephalexin is Keflex. Mupirocin is Bactriban. Seriously, pause right here if you need to. Flashcards are going to be your best friend for this slide. Okay, moving on to fungal infections. Think athlete's foot, ringworm. You get the idea. Fungi just love warm, damp places, so these infections tend to show up in spots like your feet or under your arms. And here are the antifungals you gotta know. A key thing to notice is that some of these, like miconazole, you know it as Lotrimin AF, are sold right over the counter. The PTCB expects you to know your OTCs as well as your prescriptions. And a really high-yield prescription one here is fluconazole, brand name Diflucan. Let's switch gears and talk about viral infections. When it comes to the skin, we're talking about the big ones like chickenpox and shingles. These are caused by, well, viruses. Now look at how similar these names are. Acyclovir, or Zovirax, and valacyclovir, or Valtrex. It is so easy to get these mixed up when you're under pressure, so come up with a little trick to keep them straight. Maybe you remember that Val is for Valtrex. Whatever works for you. All right, our last type of infection here is parasitic. This is when little critters decide to make a home on someone's skin. The two big ones you've absolutely got to know for the exam are lice and scabies. And here are the go-to treatments. Permethrin, brand name Elimite, is a super common prescription for scabies. So whenever you see a question about lice or scabies, your brain should automatically jump right to these specific drugs. Whew, great job with all those medications. Now, let's pivot to another really important topic, how to tell the difference between various types of skin damage, like lesions and ulcers. So it's super important you know the difference between primary and secondary lesions. Think of it this way. Primary lesions are the first thing that happens, like a blister popping up. Secondary lesions are what happens afterward, like a scar that forms once that blister has healed. Oh, and another word for scar you might see is cicatrix. Okay, let's zero in on a specific type of ulcer that is a total classic on the PTCB exam, pressure ulcers. You see these a lot in patients who can't move around much, and knowing how severe they are is a big deal for patient safety. This is all about progression. Stage 1 is simple. The skin's just red, but it's not broken. By stage 2, you start to see blisters or sores. In stage 3, it gets serious, with deep tissue loss. And stage 4, that's the worst, with damage going all the way down to the muscle and bone. Make sure you have these 4 stages memorized in order.
Wow, we have covered a ton of information. Let's pull it all together with a final, super fast review. Think of this as your personal checklist to glance over right before you walk into that testing center.
Okay, here we go. Number 1, match the drug type to the infection. Antibiotics for bacteria, antifungals for fungi, you got it. 2, memorize those brand and generic names. I really can't say it enough. 3, know your vocab. Pruritus means itching, erythema means redness. 4, know the 4 stages of pressure ulcers. And finally, number 5, don't forget those key counseling points, like always reminding patients about using sunscreen. All right, pop quiz time. Let's see if you were paying attention. What is the brand name for acyclovir? Come on, think back to that viral infection slide. Got it? The answer is Zovirax. If you got it right, amazing. If not, no worries at all. Just jump back and review that part one more time. And that's a wrap. You did an awesome job today getting through all of this. You are definitely on the right path to crushing your PTCB exam. Make sure you review your notes, practice those drug names every day, and hey, rewatch this if you need a refresher. If this helped you out, a like and subscribe would be amazing. Keep up the great work. You've totally got this.